How's it going, everyone? This is Taylor Lewis with the Pulmonary Performance Institute, and today what I want to talk about is integrating some static and dynamic warm-up exercises or secondary exercises that you can do to really work on improving rib cage expansion and also the descension of that rib cage as we start to exhale. So try and reduce that hyperinflation type things. And oftentimes what we like to do is we like to start with breathing, and you've seen a lot of people will work on diaphragmatic breathing to help kind of reset their system sometimes. And this is something we like to do. But then from breathing, what do we do next? So I'm going to show you some stuff we do here at PPI as an integration and kind of progression through our warm-ups. And depending on the individual, sometimes these are put into their program to help kind of reset or improve mechanical function here. So when we're thinking about breathing and we're thinking about the rib cage, we want to think about when we breathe in, pressure goes down, rib cage starts to expand, we get this external rotation. We start to open up a little bit, and ideally we want this expansion to occur all the way around these ribs. So our ribs come out and turn up, and then when we exhale, ideally they're going to come closer together. The ribs will, through tightening of those intercostals, pull our rib cage down to allow that exhalation and get that carbon dioxide out. Now sometimes we'll get some intercostal muscles that are not necessarily going to optimize their ability to relax, lengthen, let the gap of the ribs expand, and then contract, pulling them together to get that air out. So what we like to do is start right at that rib cage. So something we talk about is proximal to distal when we're thinking about our warm-up. What we mean by this is close to your spine as possible. Then we start to integrate warm-up exercises as we progress more peripheral, so we go to the legs and the limbs. So we're really starting deep within the system here. Now, one exercise we like to do is we like to get into a sideline position and really focus on one side of the rib cage. Now, obviously, when you breathe in, you're using both sides, but just lining our positions, we can start to integrate a little bit more towards one side. So we have a foam roller here. You can use a yoga block, a pillow. And we're going to be in the sideline position. What I like to do also is to find something where we can put our head on so we don't get too much lateral flexion of that cervical spine. Because once again, ideally we're trying to set up in a fairly neutral stacked position. What that means here, and everyone's going to be a little bit different, so you may need two pads or two pillows, but we want to think hips stacked on top of each other, okay? And relatively a leg at 90 degrees, and the bottom leg is going to be straight. From that position, just laying there, we're going to take our arm that's on the side of the rib cage that's up, and we're just going to relax it overhead, and this is where we're going to work on our breathing. So what I want to think about is when we're thinking about diaphragmatic breathing, we're thinking 3 to 6 count inhalation through the nose if you can, and then 3 to 6 count exhalation through your mouth. So if you have pursed lips and you're blowing 42 candles out, 1 candle per cupcake. We like to say 42 cupcakes in one line with 1 candle, and you're trying to get that last one out. So you're really trying to exhale, get everything out. Something to think about here is when we're in this position, we want to make sure we feel stacked on top of each other, and depending on how you feel, if you have tightness in the shoulder and you bring the arm overhead and that feels discomfort, bring your hand to your side. Or we often like people just to feel that rib cage expand. I like to put hand on the rib cage. From this position, you're just going to think about slow inhalation through the nose, trying to get all the pressure down, and then feel your rib cage expanding as you inhale. Now, if you can't breathe in through the nose well, start with mouth breathing, but eventually transition to working on nasal breathing because it's really good with our diaphragmatic breathing patterns we're trying to introduce. Once again, we're introducing this through our warm-up. So you're just going to lay here, breathe in, your stomach's going to expand out, but we also want to feel the rib cage expand a little bit. Remember, that rib cage really expands and turns up there. And then just exhale, rib cage tucking down, keeping it down, and then you expand in or breathe in again. And as your breaths increase, you're going to start to see a little bit more lateral expansion here. And then we do this on the other side. And we're thinking anywhere from 1 to 3 sets of 3 to 6 breaths on each side. Okay? Now, like I talked about progressing this from more of a static to dynamic situation before warm-up, or this is also good before respiratory treatment. Now, laying here and breathing is dynamically focused at a very micro level. But what I want to introduce a little bit more dynamic positioning now of integrating the thoracic spine, lumbar spine, and working on a little bit of thoracic mobility as we do this. So what we'll do is, after we've done a set of 3 to 6 breaths on each side, what we'll do is we'll come back to this. Let's say I just finished. I'm going to take my hand and I'm putting it at the bottom rib cage. So right on those ribs. And what I'm going to think about doing is I'm going to work on T-spine mobility here. So we talk about how the spine, especially the thoracic spine, connects to those ribs. So we just worked on some rib expansion. Now let's work on some thoracic rotation to integrate into this. So we put our hand at the rib cage, relax the head, and then exhale, and then just pull at the ribs, rotate your torso, and then come back through. And as you'll see, we're not doing a lot of motion. The key here is often we forget is we want to move around a stable base of support. So what that means is if my hips are stacked, my leg is on the foam roller or a yoga block, as I rotate, I don't want my whole body to move, because then I'm compensating or I'm adding ranges of motion that come from somewhere else. I want to see, can I rotate my spine? And I like to think more of the sternum and pulling the shoulder blade down versus the arm to get there. So we're just going to hang out here, pull, come back through, and allow your head to go with it a little bit, especially if you're tight, and then just nice and slow and controlled. So now we're integrating a little bit more dynamic thoracic rotation after we worked some rib cage expansion. Integrating just at that level those two exercises, first working on breathing, but not just breathing, kind of really focus on an expansion of the ribs in multiple directions. So we can get really good at expanding more of this anterior to posterior or up and down, which tends to see with people that are hyperinflated, they'll be here. But we often forget that we also need to expand from the lateral aspect or get this 365 degrees worth of expansion. So when we're thinking about breathing, we have to think about working on our diaphragmatic breathing through different positions, whether that's seated, side lying, standing, whatever that might be, because there's an integration with our body from a musculoskeletal standpoint. So this is where we'd like to come back and start from the beginning, opening up that rib cage, working on lateral expansion in through the nose, really feeling the expansion. Once we feel some good expansion there, we want to add some thoracic rotation, because once again, we have to think about, if this is my rib cage on the back side of that spine, our ribs collapse and rotate, and on the back side, the spine is going to turn with it. Okay? So we have to understand that the thoracic spine integrates with the ribs and the ribs integrate with the spine. So we want to target both areas, because sometimes it could be rib cage doesn't expand well, and sometimes we lose a little bit of thoracic mobility. So we want to make sure we integrate both. And this is why we start just nice and easy, hips stacked, open up as long as the shoulder can go above, or like I said, if you don't feel lateral expansion of the rib cage, put your hand there. Slow inhalations. The slower and longer the inhalation, the slower and longer your body is able to adapt. Okay? So we want to make sure, especially if you're restricted, the slower you go to allow any barriers to kind of slowly break through and then get that expansion. Now, you may not get it in that first set. And this is why, especially if you're restricted, we always recommend 2 to 3 sets minimum when you really feel you got chest wall restrictions going on. Okay? Let your body learn or relearn that lateral expansion component. And then when you feel comfortable, then we add that thoracic rotation and putting the hand at the rib cage and only trying to pull that shoulder blade down and pull at the rib cage. That allows us to narrow in just on the spine versus adding the arm as an extra degree or element that could change our true rotation and mobility. So that's key to think about when we're talking about improving mobility and expansion of the upper torso, is think more proximal to distal to start. And everyone's going to be a little bit different. So you may start at the thoracic spine and then go to the rib cage. But just think, get close to the body, work on or resetting that breathing to get some rib cage expansion. And that could reset kind of your thoracic mobility. And all of a sudden you're like, wow, I didn't realize I had more mobility when I actually worked on rib cage expansion, especially from a lateral standpoint versus that anterior to posterior. So think about that, especially in the warm-ups, but this is also really good before respiratory treatment, because once again, when we're trying to maximize respiratory treatments, we want to get the system, and especially what we don't think about is the musculoskeletal system, not the respiratory system always, but remember your muscles, your diaphragm is a skeletal muscle, so we want to make sure if we improve or warm up the system or prepare the system for what we're going to do, there's a better chance we're going to optimize our outcomes. It's like warming up before you exercise and whatnot. We have to think in that realm. So think one option, sideline first, work on lateral expansion, then go to T-spine work, and that could be something that could be very beneficial for you if you integrate into your respiratory or right before respiratory treatment or within your warm-ups if you're feeling rib cage restrictions or some upper body torso restrictions.